I'm Jill Stenerson. I am a licensed mental health counselor and a trauma and addiction specialist working at the Marriage Recovery Center. And today I'm going to talk a little bit about working with trauma in the context of an emotionally abusive marriage. And I want to put two sort of caveats out there first. Number one, I'll be talking about this from a traditional male-female marriage or committed partnership. Understanding these dynamics can take place across genders and relationship dynamics. So, but for simplicity, it'll be a male-female example. And also operating from the standpoint of that we're seeing a client who has a partner who is also being treated for their behaviors, working through their issues of narcissism, emotional abuse, acting out, addictions, if those are at play. So those assumptions are, I just want to put those out there. So often what shows up in my office with a partner in one of these dynamics, she comes in, she's really gotten really clear that abuse has been present, and she wants to know how she can trust her partner again. And she can talk clearly about what's occurred, maybe, but as she begins to sort of describe what's going on in her life, it becomes really, really obvious that there is the act of the abuse that's been ongoing, but then there is the fallout and really the system that she has created to manage, avoid, dodge, keep a lid on really the abuse that's been going on. And that's where we talk about the word trauma. And not everything is a trauma, and not every trauma requires treatment. But when you find yourself sort of orienting your entire life around avoiding unsafe, fearful situations or avoiding the other shoe dropping, it's likely that you are in what we would call sort of complex PTSD, which is that your emotional sort of regulating system is really, really tied and organized around these behaviors. And that really does require some specific treatment. And I like to use a metaphor for how we do work related to trauma, and particularly when you talk about betrayal trauma, which is what is going on in an emotionally abusive relationship. It is that the trauma is occurring at the hands of someone you love and trust. And so there's this, flip-flop of this is a person that's supposed to care the most for me and they're harming me, which is different than trauma at the hands of a stranger. So I like to think of it as like being on a baseball team together. You and your partner, you go to the game, you're up to bat, you make it to first base, you're there, you're cheering on your partners at home plate getting ready to hit, and all of a sudden he looks at you and he runs towards you with the baseball bat and hits you over the head with it, and you are laid out. It's a little bit what betrayal trauma feels like, right? And so from the treatment model, we start throwing all kinds of resources at the guy with the bat. We want to get the bat out of his hands. We want to get him to learn how to play maybe new sports, learn how to recognize when he's feeling like he wants to run towards you. You get the metaphor, and hopefully that's all occurring. Meanwhile, you're laying on the ground with a concussion and a broken leg. But when there's chronic abusive behavior going on, you're not probably laying on the ground. You're actually probably continuing to play baseball. And so, but you're not playing it really well. You've got a broken leg. You haven't identified it. You're limping around. You're running in circles. You're throwing the ball wonky. And that is really where sort of the trauma work needs to come into play. So how that works in my office is we actually need to take the view off of the batter, frankly, and turn it completely on you. And so we're going to pull out those videotapes. We're going to start probably with looking at more recent tapes, and without a focus on him, not on the event, but on how are you playing? Like what is going on? How are you functioning in your home? What's going on in your relationships? What are these sort of negative adaptations? How's the broken arm showing up? We're going to identify that there is a broken arm and that's why you're struggling with these things, right? And then we're going to pull out some other tapes and we're going to really zone in on a couple of those key moments where your partner did come hit you over the head with a baseball bat. and we're going to look at where he hit you, and we're going to look at the injury up close, so that if you guys keep playing baseball, and if I can get out of this metaphor, you know, if you're going to stay together, and again, with the assumption he's doing his work and safety is being established in the home, that you aren't running around with broken legs and concussions wondering, well, he doesn't have a bat, but it still feels like he's coming towards me, right? Hopefully that makes a bit of sense. So at the Marriage Recovery Center, we are looking to maybe do some intensive work around this, where you would come in to my office and we would be doing some specific sessions around how is the trauma playing out in your life, looking at some of the specific events, and then really building some new skills so that you can re-enter this without these old injuries constantly showing up, or at the very least recognizing what the injuries are and what you need to do to keep treating them. Anyway, I hope that's helpful. I would encourage you, if this is interesting to you or has kind of hit a nerve, you can do lots of reading on betrayal trauma, complex PTSD, look at some of those diagnostic criteria, and look for, clinician that is trauma trained, as that kind of work really does need to be done in a professional's office. Anyway, we have some wonderful resources at the Marriage Recovery Center. We've got some great articles about the impacts of narcissistic emotional abuse and some of the ways in which we treat it. Anyway, I look forward to working with you. Call one of our client care specialists if you have any questions.